Okay, let's dive right in today. We're looking at something that, well, it could genuinely shift things for treating a really common health problem.
Yeah, absolutely. We've got some fascinating research just published in JAMA, actually.
Right, JAMA. And it's focused on a new kind of injection treatment?
Exactly. It looks like it could be a potential game changer for people dealing with high blood pressure.
So our plan today is to really unpack this research.
Figure out what the study found, what this new treatment actually is, and, why it might be such a big deal for potentially millions of people.
Before we get into the specifics of the new treatment, maybe let's just quickly frame the problem. High blood pressure, it's huge, isn't it?
Oh, it's immense. I mean, the source we're looking at points out it affects something like 1 in 3 adults just in the UK.
Wow, 1 in 3.
And that's pretty typical globally. And the real challenge is, even with the drugs we have now, it's often not controlled as well as it should be for a lot of folks.
Right. And the consequences of not controlling it are pretty serious.
Definitely. You're talking about a much higher risk of really bad stuff, heart attacks, strokes, even dying prematurely. It absolutely needs good, consistent management.
Okay, so that sets the stage, which brings us to this new treatment in the JEMMA paper. It's called zilebesiran.
Zilebesiran, yeah, that's the one. And the key findings we're discussing come mainly from a study called the CARDIA-2 trial.
CARDIA-2. Okay, what kind of trial was this?
It was pretty significant. Global, randomized, involved 663 people.
Okay.
And importantly, these were people whose blood pressure wasn't under control, even though they were already taking standard blood pressure meds.
So this wasn't for people newly diagnosed. These are people already on treatment but needing more help.
Exactly. So in the trial, these patients got zilebesiran, which is given as an injection, basically added on top of their existing therapy.
Right, an add-on. And what did they find? What was the result?
Well, the main finding from CARDIA-2 seems pretty clear. Adding zilebesiran led to significantly bigger drops in blood pressure compared to the patients who just stayed on their usual meds alone.
Okay, so it works as an add-on therapy. That's important.
It is. But I think what's really making people sit up and take notice here, and the source really highlights this, is how it's given and how long it lasts.
Ah, right. Tell us about that part. That seems key.
It's an injection, yeah, but the really novel thing is the schedule. It's just one injection every 6 months.
Once every 6 months?
It
Serious?
was twice a year.
No.
That's it. And this single shot was shown to provide a meaningful and sustained drop in blood pressure over that whole 6-month period.
Wow. I mean, you compare that to taking pills every single day.
Exactly. The potential difference for someone actually sticking to the treatment and therefore getting better control, it could be huge.
Okay, so it works, and it lasts a long time. How does it actually do that? What's the mechanism inside the body?
So it uses this really quite advanced technology called RNA interference, or RNAi.
RNA. Yeah.
Basically, it works by stopping the production of a specific protein. This protein, angiotensinogen, is made mainly in the liver.
Angiotensinogen. Okay, and blocking that protein, how does that lower blood pressure?
Well, angiotensinogen is sort of the starting block for a whole cascade in the body called the renin-angiotensin system, or RAS.
Ah, the RAS system.
Yeah?
Yeah, lots of current drugs target that pathway too, right?
They do, but often further down the chain. Zilebesiran works by interfering with the RNA message for angiotensinogen itself, so it cuts off the supply right near the source.
So it stops the cascade before it really gets going.
Pretty much. Less angiotensinogen means less of the downstream stuff that usually constricts blood vessels, so the vessels can relax more easily.
And that lowers blood pressure.
Exactly. And like we said, it's given just as a subcutaneous injection, just under the skin.
The paper also mentions some insights from the investigators, doesn't it? Someone called Dr. Saxena.
Yeah, Dr. Manish Saxena, he's a hypertension specialist, and he was actually the UK lead investigator for the study.
Okay, what did he emphasize?
He really highlighted this ongoing problem that globally we're just not doing great at getting blood pressure under control. Rates are still pretty poor.
Which leads to all those complications we mentioned.
Right. And he pointed out that this CARDIA-2 study shows zilebesiran works and seems safe when you add it to the common first-line drugs people are already taking.
So it plays well with others, so to speak.
Seems that way in this trial, yeah. And he also really hammered home the novelty of that 6-month duration. He saw that as potentially having a huge impact for, millions of patients who struggle with taking meds every day.
Makes sense. So these phase 2 results look promising. What happens next for zilebesiran?
Well, the source says more studies are already lined up. There's another phase 2 study coming called Cardia 3.
Cardia 3, what's the focus there?
That one's going to look specifically at using it in patients who already have established cardiovascular disease or who are at very high risk for it.
Okay, so a higher risk group.
Right. And then probably the really big one, later this year, they're planning to launch a large global outcome study.
Ah, the outcome study. That's where they look beyond just blood pressure numbers, right?
Exactly. That's the crucial test. It'll investigate whether zilebesiran actually reduces the number of heart attacks, strokes, and deaths from cardiovascular causes. That's the ultimate proof the medical world wants to see.
That'll be key. This source also mentioned who funded the study.
Yeah. Funding came from Alnylam Pharmaceuticals, and it mentioned Barts Health NHS Trust in the UK was a lead site.
And a top recruiter in Europe, apparently.
Yeah, which just shows, the significant effort and interest behind this research.
So let's bring this back to you, listening right now. What could this actually mean for people? Think about the current situation. Often it's pills every day, maybe multiple pills, possibly for the rest of your life.
How different would it feel if managing your high blood pressure involved just, say, 2 injections a year?
It could potentially simplify things dramatically, couldn't it? Maybe help people stick with treatment better, especially if they struggle with daily pills.
You'd think so. Better adherence usually means better control, particularly for those who aren't quite getting there with the current options. It really offers a different model for managing a chronic condition long term.
Yeah, it really could be potentially life-changing for a lot of people around the world.
Absolutely.
Okay, so to wrap up our deep dive today, here's something to think about. We know that getting blood pressure properly controlled is still a massive challenge worldwide, even with all the daily pills we have.
Yeah, the control rates aren't great.
So how might a treatment like this, one that works for 6 months at a time from just one injection, how might that fundamentally change the whole strategy for managing hypertension? And what could that mean for public health outcomes on a bigger scale?